Good day, everyone. Welcome to another episode of the Seco Direct podcast, the podcast that brings to you the need for a proactive approach to healthcare regarding yourself or regarding any one of your family members. And my name is Dr. Tiwa. Today, we're going to discuss about one of the most important organs in our body, and that is the kidney. We're going to talk about its functions, things that can affect it, things to avoid so that your kidneys cannot be affected. But if they are, things to look out for in terms of symptoms, the investigations to do, the questions to ask your healthcare providers, as well as the treatment modules that you can go through. We hope to keep you very informed with this topic, and we'll see you on the other side. Well, among healthcare professionals, it is generally accepted that diet and nutrition plays an important role in the management of diabetes, and it is necessary to supplement them with vitamins and mineral salts because they play a crucial role in managing these cases. Patients often struggle to maintain an adequate diet, especially when it comes to portion controls, weight loss programs, and stressful lifestyles. And additionally, these vitamins and mineral salts provide specific benefits to these patients. Alphabetic Plus is a supplement designed specifically for pre-diabetics and diabetics because it contains alpha-lipoic acid, which is a powerful antioxidant, and also contains 24 other essential minerals and vitamins. Research has shown that alpha-lipoic acid is the universal antioxidant, acting on both water and fat medium. It also helps to metabolize the breakdown of carbohydrates and acts on oxidizing species and free radicals. Additionally, it can recycle other antioxidants such as glutathione, coenzyme Q10, vitamin C, and vitamin E. It is not like every other multivitamin as it is uniquely designed for pre-diabetics and diabetics. It only contains vitamins and minerals needed by the patient's category at specific strength and proportion. Additionally, it does not contain copper or iron compounds, which pre-diabetics and diabetics should not take. It also benefits in preventing polyneuropathy. Things like numbness, burning sensation, paresthesia, tingling sensation, all these conditions that are associated with diabetes and end organ damage. So as I've stated before, alpha-lipoic acid is an antioxidant that works against free radicals and reactive oxygen species. It also serves as a universal antioxidant, helping with carbohydrate metabolism and improving glucose uptake by enhancing insulin sensitivity. Additionally, it recycles antioxidants such as vitamin C, vitamin E, coenzyme Q10, and glutathione, which ensures proper cell function. So Alphabetic Plus does not contain iron and copper, as research has shown that iron and copper are generally in high concentrations in diabetic patients as well as pre-diabetic patients, and they are major sources for radicals generation. Hence, one will be worsening the problem by this additional supplementation. Yes, Alphabetic Plus has cardioprotective benefits because it consists of two crucial ingredients, taurine and lycopene, shown by research to have cardioprotective benefits. Taurine, for instance, exerts anti-inflammatory benefits that improves diabetes and has shown cardioprotective benefits by acting on the renin-angiotensin system, while lycopene exerts cardioprotective function by lowering low-density lipoproteins associated inflammation as well as modulating high-density lipoprotein functionality towards anti-atherogenic effects. The anti-atherogenic effect is the process of forming plaques in the intimal layers of the arteries. It has anti-inflammatory and antiplatelet effects like blood clotting and impairs cholesterol synthesis. So with Alphabetic Plus, it has a lot of benefits that you should consider, especially as a pre-diabetic or a diabetic patient. And I hope that all these light that I've shared on all these benefits will inform your decision appropriately and will let you know that Alphabetic Plus is the best multivitamin to get out there. So what are kidneys? So kidneys are two bean-shaped organs located in your back, your lower back to be exact. And their main job is to take away dirt. I'm putting that in quotation marks. So when you say take away dirt, we call them the filter organs of the body. That is, any unwanted substance in your body that might have been brought there either through ingestion or through the environment. The kidney is tasked to make sure that those harmful substances do not stay in your blood for as long as possible. They also help in making red blood cells. They help in regulating your blood pressure, and excess fluid that needs to be filtered out of your body. Your kidneys are able to make sure that occurs. Especially well-functioning kidneys, they maintain the overall fluid balance in your body. The kidneys are very small, but they are very mighty in terms of what they do for you and how they work for you. Understanding what kidney disease is. When we say kidney disease, we mean that these are conditions, or these are things that can cause kidney damage, that can cause for your kidneys to not be able to do their function as well as they are meant to. Meaning, like I said before, they help to filter waste. That means the kidneys being damaged means they are not able to effectively clean out waste as well as they should. And also they are not able to maintain the overall fluid balance in your blood as well as they should. Now, things that usually affect the kidneys they usually tend to be chronic. When you say chronic, it means that the affecting of the kidney is over a long stretch of time. And one particular example of that is the chronic kidney disease, because it's a progressive disease. When you say progressive, it means that it gets progressively worse. The affection starts and it gets to a point where it could be reversed, but then once it passes that point of being able to be reversed, it becomes a chronic condition. And we don't want to get to a point where it is a chronic condition, because at that point, we start getting into modules like dialysis or a kidney transplant so as to maintain good health. Now, this chronic kidney disease is usually divided into 5 stages regarding what your effective glomerular filtration rate is. When we say effective glomerular filtration rate, the glomerulus is a part of the kidney that is very active in filtering bad substances or harmful substances in your body. So if that rate is lower than 90, or low as it goes, is where the stages are, the cutoff mark of the stages are. So if it's above 90, that's usually the best glomerular filtration rate. But once it gets below 90, then we start having the different stages, and there are 5 stages in total. Now, what are the causes or the risk factors that we need to look out for when it comes to the damage that can be inflicted on your kidneys? Now, this is very vital because in our country, in our landscape, the things that affect our kidneys are called silent diseases. They're things that people tend to overlook because they do not have dramatic symptoms. When we say dramatic symptoms, a perfect example of a condition that's a dramatic symptom is Ebola, because you bleed from different orifices. You bleed from your nose, your eyes, your mouth. So because that symptom is very dramatic, people tend to take things like that a bit more serious compared to these things that affect our kidneys that do not have so much of a dramatic symptom. For example, very, very common condition that people overlook: high blood pressure, hypertension. Now, you don't see any symptoms of hypertension until damage has been caused. So this hypertension, it's because your kidneys are supposed to regulate pressure around your body. So if there's increased pressure in your vessels, then we have things where your blood vessels or the kidneys become damaged. Now we also have diabetes. The first sign of kidney disease that is caused by diabetes is if you see that protein isn't being filtered and it is seen in your urine. A protein called albumin. Once that is seen in your urine, that shows an affection of your kidneys by diabetes. And diabetes is also a condition that the symptoms are not well known or seen until there's affection. Other causes of kidney damage include: one, glomerulonephritis. When we say glomerulonephritis, no, we've already talked about the glomerula that filters blood. So once that glomerula is infected or inflamed, that's the filter unit of the kidney. That's what we call the glomerulonephritis. And that thing that can cause affection of your kidneys is what we call the polycystic kidney disease. It's in the name. There are polycystic, a lot of cysts in the kidney. That is what is called polycystic kidney disease. It's a genetic disorder. So if you have had an history of this condition, then it is likely that you might have it again if you are not careful. Now, repeated urinary tract infection can also affect your kidneys because they lead to chronic damage. And then long-term use of medications. In our climate, we use a lot of non-steroidal anti-inflammatory drugs like diclofenac. Those are pain medications. So if you use a lot of pain medications or some certain antibiotics, they can also have a bad effect on your kidneys. Now, risk factors for chronic kidney disease is the most common one is if you have a family history of chronic kidney disease, you should be much more careful in terms of what you do to affect your kidneys, because there's a likelihood that it could also affect you, especially with people that are over the age of 60 years old. There's a higher risk in people of African American descent, or Africans, or Hispanics, or Native Americans also. And lifestyle factors like smoking and obesity are also things that you should look out for. Now, we've talked about the general overview of a kidney disease. What symptoms should we look out for when we are talking about kidney disease? Now, we've already spoken about how the kidneys help in filtering or maintaining the overall fluid in the body. So what symptoms would we see when that is not working? First of all, we will start seeing edema, swelling of the legs, the ankles, the feet. Also, since the overall fluid level is not properly controlled, we start feeling a feeling of drowning, which is like a shortness of breath. They will start also feeling persistent itching, nausea or vomiting, fatigue, and also changes in your urination frequency or appearance. For instance, you might start urinating and you probably see signs or streaks of blood. In some cases where there is affection of like stone in your kidneys, you might start seeing streaks of blood in your urine. So those are the things that you should look out for when you're looking at the symptoms of any kidney disease affection. So moving on, in terms of testing for kidney disease, there are three things that we always want to look out for. So we've said our kidneys are filters. So first of all, we have to check the blood to see if what the kidneys are meant to do in terms of removing harmful substances in the body is being done effectively. So we do what is called a renal function test, or what is called an electrolyte urea and creatinine test, just to see the level of these substances in our blood. Now, if they are elevated in some instances, then the kidneys are not doing an effective job of filtering these harmful substances away from our blood. The second thing we need to look out for is structurally. So we do an ultrasound test just to see how the kidneys are structured, just to see the kidneys, the urethra, to see that everything structurally is competent with the kidneys, because you could see things like maybe stones in the kidneys, for instance, or any swellings in the kidney, for instance. That's when we do a structural evaluation of the kidneys. And lastly, we check the urine. Now, the kidneys are meant to filter some things to make sure they don't even get to the urine. So if you see things like protein, that's where we get something called a nephrotic syndrome. It will mean that the kidneys are not being able to stop useful substances from getting through to our excretory organs, for them to be urinated away. So these are the three things that we need to do in terms of testing. We need to test the blood through a renal function test or electrolyte creatinine test. We need to check for the structural competency of the kidneys by doing an ultrasound test. And lastly, we need to check out our urinalysis to see if some things that are useful for our body are not being urinated away with our urine. When it comes to treatment and management, the sooner you know what the kidney disease entails, the better for you. So if you catch a kidney disease at the early stage, you might be in a situation where treatment of the underlying condition is all that is needed. For instance, if it is diabetes that is causing the kidney affection, you'd have to maybe increase your dose of the anti-diabetic drugs that you're using to make sure that that will reduce the pressure on your kidneys and make sure that your kidneys bounce back as early as possible. If it's hypertension, you use your antihypertensive medications so that the affection on the kidney is reversed and it feels better. If there's any medications that you're using that is affecting it, you cease the medications. If it's smoking or obesity, you do some lifestyle modifications by doing regular exercise, maintaining a healthy weight. Smoking cessation also would also be beneficial for you as long as you catch it early. But the longer this kidney is affected and the progression into chronic, we start getting into conditions where you would need to have to do regular dialysis, or in a last cause scenario, a kidney transplant. And we don't want to get to that position because the symptoms that would facilitate that kind of condition are very intense and can cause bad effects on your mental health, for instance. So we would always endeavor for people to catch this kidney disease as early as possible so that we do not have any issues moving forward. There's a story I have in terms of making sure that you understand the gravity of what chronic kidney disease can do or impact on people's life, and the way you might not even know that you've had this condition until it is almost too late. Where I was practicing initially, there was a patient that just came in and said that they had what is called hiccups and their hands were shaking. So when you look at things like that, hiccups and my hand is shaking, you might think, oh, why doesn't he drink water now? Why does it require that I come to the hospital? But there's some hiccups that last for the whole day, even though you drink some water and you do different things to make sure that the hiccups go. So for instance, this patient came into the emergency, came in with their own 2 feet, walked in, just complained, oh, I've just been having persistent hiccups. They are not going. And my hands are also not stable. So I just want to understand what's going on. And this was an able-bodied man, very fit, not that there's anything wrong with him or anything. And once he mentioned that for a healthcare professional, once you say you've had a lot of hiccups and also your hands are shaking, the first thing they usually look out for is that, oh, what is wrong with your kidneys? Because that would mean that your kidneys are not filtering out something very essential from your blood that is causing these hiccups to continually persist. And when we checked the renal function test, it was already a candidate for dialysis. That is how intense it is, because if you had not even come at that period, he could have gotten to a point where his body would just completely shut down. So he had to do dialysis immediately. So that is why we always talk about being proactive with your health. You need to go and do like a general checkup twice a year just to know where you stand at this particular moment, especially if you know that, okay, I've been diagnosed hypertensive and everything, because a lot of people in our climate do not want to use medications when they know that they're hypertensive. And these things always progress to worse conditions that you would have wished that you already just treated the hypertension or managed the hypertension as it was, rather than having it affect your kidneys. And now you're in a position where you have to start doing twice a week dialysis. Dialysis in this part of the world is not a fun procedure to go through consistently for a long period of time. And we don't want to be in a position where we have to do that for a very long period of time just because we want to have a normal lifestyle. Fortunately, we have to end here, and I know it's a damn note to end on. But in Circle Direct, we always want to make sure that you understand the gravity of what we're talking about, as well as know the very hard reason as to why we always say be proactive with your health. Always be ahead of everything regarding your health. And with kidney, it is very, very great for you to be a little early than for you to be a little late. Thank you very much for coming and listening to this episode of Circle Direct. Until next time, I bid you adieu.